It's Mental Health Monday with Hope, a sanctuary where hearts can find solace. Together, we stand strong, united in our journey, discovering the strength within ourselves. Have no fear, for we're not alone.
Hey, happy Monday, everyone. Thank you for joining Mental Health Mondays. What do you think? I got this cute little ponytail going on. I had taken a bit of a break because I was dealing with an injury. So we'll talk about that a little bit. How cute is that? Tonight, my guest is, we were going to wrap with Kendall. And I think, Kendall, I think people were looking forward to it. There were some people that were looking forward to it because when you and I just wrap, you know, we have a good time and we go into many topics. So I'm going to put it out there that maybe I should come on your show with you soon and we'll just rap about anything. How's that sound? Mm-hmm. All right. But I have my guest that was supposed to be here a few weeks ago when I had to cancel my show because I was injured. And we were all ready to rock and roll. And I'm so glad that she could be with us this evening. My dear friend and RN, Jeanette Michaels. And we're going to talk about women's healthcare and the frustrations over not being taken seriously. And we're going to talk about menopause too and all the things that they don't tell us. So let us welcome Miss Jeanette to the show. Bonjour, mon ami Jeanette. I just love saying that, you know, in little French. How are you, my friend?
I am good. Thank you. I am good. I just got back from a weekend in Baltimore. So
okay. And you know, for people that don't know, you're down in North Carolina these days. And how is everything going? We were here with you before you took your nursing test, and we're here with you after you've become an RN, and we're here with you when you've started your new job down in North Carolina. So how's it all going?
So first of all, with our positive affirmation, fits right into that. As I thought about that tonight, I am a continually evolving human being with a significant capability of learning, as all humans are. But
absolutely,
you know, it kind of fits right into that question that you just asked. Because yes, I passed the NCLEX in January. I started my new job in February, and in the ER here at a North Carolina hospital. And I think the biggest thing I've learned through the process, so I got some advice that from some of my very experienced coworkers back home in Pennsylvania, that as an older woman, I come with a lot of experience in healthcare. And the advice I got was put that experience away and learn things the way they want you to do things here. Looking back at my start, I am not sure, not that it wasn't beneficial, but I think it set me behind a little bit in my orientation process. And I think it frustrated me a little bit. But through the evolution, you know, now I've been at this now. So we are in the 8th month. I started, so now I've been at this 6 months, right? So, and even your 30-year veteran nurses are continually learning. And I think the biggest thing I've learned is nursing is a team sport. Basically, you're not in it alone. You cannot do everything alone. And you have to learn to be able to assertively ask for help when you need it, which I am not good at, right? I'm not good at being assertive,
right?
Which is kind of why tonight's topic is so important, especially for women. It's still a learning journey. And, you know, most nurses tell me that you don't really feel comfortable fully until after that year point. You know, I kind of sometimes will be in the middle of like pushing an IV med and I'll be like, holy crap, I'm really doing this. This is real, grown up RN stuff, you know?
Right.
But I take that very seriously in the fact that people's lives lay in the balance as I exercise my nursing judgment. So,
Absolutely.
it's a very important job, and one that I take very, very seriously, um, and very compassionately and very empathetically, as
Right.
I
Right.
learn to be emotionally intelligent, and as I progress through my older adult life.
Right, right. And I feel that obviously medicine is something that is constantly evolving, and growing and expanding. And if you have a mindset of, this is how we've always done it, I've always done it, this has always worked, and you're not willing to look at new ways or changes, you're kind of getting behind the times because it's always evolving.
And I've had a saying for many years that I've worked in healthcare as a medical assistant, as a tech, and I forget where I heard. It's been years since I've heard this expression, but I always tell people, when they come at me with their frustrations that, um, hey, this doctor screwed me up. Here's what I come back with, because it's very true, is we only practice medicine. If we had perfected medicine, we would be God,
Right,
and we are not. We
right,
only practice medicine. We practice medicine based on evidence of things that have worked in the past. We call that evidence-based medicine. And
right.
so, you know, it's very, I know you've said that, cut to the chase here. You've said that you've had a lot of questions. How do you get people to hear you? How do you get the providers to hear you? Um, I think that as patients, as providers, we have to realize that, you know, it's not a perfect science, you know. And ultimately, and I personally believe that there's a higher being that guides us through this universe. So, it's all up to that number that's being called from above or wherever, space,
Right,
whatever, wherever, so, it's not an exact science. So,
right, right.
you
And
have
when
to, you have to give some grace there.
Sure, absolutely. And when you say it's evidence-based, part of that is if you have people discussing the same symptoms, different people talking about the same symptoms, um, when we're going to talk a little bit about menopause. They're having the same symptoms and they just happen to also be going through menopause. I mean, you have to start to accumulate all of those stories and start to say, hey, maybe there's something to this. And that's how we also grow in medicine is, you look at what the patients are telling you. And I think, one of the reasons I wanted to have this conversation tonight, is because, I have had a few friends talking to me about medical situations that they are having, not related to menopause, but medical situations that they're having where their medical team has pretty much, called them hypochondriacs, has told them that it's anxiety, have told them that they're depressed. And now, granted, I mean, if you're in chronic pain for a long time, that can trigger the chemical receptors. So then, yeah, I mean, pain is a trigger for depression. But they were looking at this depression or what have you as the situation and not a symptom that was being caused by the situation, if that makes any sense. And I feel that happens more with women in the medical setting when they're the patients than it does with men.
So, and I think it does. I also think that as women, and I'm going to throw out this term here because it's something that, my son's a nurse also. He is
Right.
actually a master's level nurse educator. And so something had showed up on TikTok over the weekend, and my son and I share different TikToks from like Nurse Erica, who she's actually a legal, I believe she's on TikTok, and I believe she's a legal nurse. And with different things, we're like right now, Mount Nittany is looking at a strike, UNC here, they're now bidding on these shifts to pick up. There's different things going on across healthcare in different areas of the country, and of course, Kaiser just bought out Geisinger with their new Risant Health, so there's different things going on in the country that makes this so important to talk about, because, with all of this bigger, better, whatever, the patients ultimately do get lost,
Right.
But I think as women, and, the term I'm throwing out there is microaggression. And, James and I had a very strong discussion on this, because, I just recently experienced it in a clinical setting as a new grad RN, and where I had asked for a certain order to protect my patient. And I was laughed at, and I ended up filing an incident report against these two physicians. I put my documentation in a row. I immediately come home and called one of my colleagues that I went to nursing school with, and who has experience in this specific specialty that I saw in my ER. And I said, this is what I did. And of course, first phone call was to my son, was like, oh my God, because I left there not knowing whether I wanted to scream, laugh, cry at the whole situation, because I was so angry. And so my son is always my sounding board, because he is a nurse educator, right? So, and then of course I called my colleague who's worked in this specific specialty for a very long time as an LPN. So it turns out I had done everything correctly. And, it's interesting. So I had experienced that, I've also, I've also experienced that on an age level. I've experienced it as a female, but,
so explain that situation more. So you're saying that you wanted to write an order for a patient.
I wanted an order from the physician for something that would help the patient. I don't want to go into too much detail, because
whatever. I just want to have it. Yeah, you don't have to go into like the specifics of what it was, but so basically,
I had asked for a specific order for a specific reason, and the two physicians sat at the desk, and made fun of me for requesting that order.
Okay.
Pretty much saying I didn't know what I was talking about.
Gotcha.
So when in reality, I really did.
Sure.
So anyway, so microaggression, it's kind of like a discrimination without even realizing you're discriminating, right? And I think what happens, and I've realized this more as I move forward in my personal relationship with my spouse, sometimes as women, and I know for me, this is the case, when I get frustrated and when I get hurt and angry and all sorts of things rolled in, I become reactive, right? So I react to certain things instead of being assertive. Reactive versus assertive. You get much less with reaction than you do with assertiveness, right?
Right.
So when we talk about women not being heard, and some men in some cases, I've seen that in my ER as well. I've compiled some suggestions that we'll talk about to try and help you to be more assertive with getting your point across and getting your questions answered versus reacting, like I talked about at the beginning, where it's like, well, they really screwed me up. They didn't hear me. They didn't listen to me. And for this reason, I have now having this, so.
And I'm thinking of 3 women in particular of their situations where I know that they are assertive. I know that they advocate for themselves medically. So, it's been even more frustrating for them. Again, that microaggression, like you said, to be called out on things that are totally irrelevant to either the situation or their behavior, because they haven't expressed any sort of a negative or an anxious behavior. They just were continuing on their medical team to say, no, I'm still having this, or I'm still having that, or no, it's not that. No, I don't, it's not stress. It's not anxiety. No, it's something more going on. I know my own body.
Yes.
So, the 3 that I am thinking about are very good advocates for themselves, but, where I feel then it becomes really important, about discussing this show tonight, doing this topic on the show tonight, is that there are plenty of people who don't advocate for themselves because they either don't know how, they don't know what to ask. They just take it for, you're having anxiety over having these, this pain, and it's exacerbating it because of the anxiety. Oh, okay. Well, and then it doesn't go away, and by that point you could have been really looking at the situation, more in depth. And the things that I'm talking about are not, they're not typical. Like again, the 3 people that I'm talking about in particular, these are 3 out of many, many women that I've talked to that feel that they're not taken serious with their healthcare questions. But these 3 in particular are rare diagnoses, and one is still in the process of being diagnosed. And I've actually connected 2 of these people together because for me, what they're sharing, what's going on, I'm like, wow, these symptoms sound like, my other friend. And, maybe you guys should have a conversation because, this other friend would be more equipped to suggest what to ask, and so having this conversation and having, the questions and pointers for people is very, very important.
So it is. I think with what you're saying or what I'm hearing, I want to remind everyone, different healthcare providers have a very varying degree of knowledge. And that's what, and that's and that's part of why I'm going to go back to what I said at the beginning, where nursing and caring for patients is a team sport, right? So every provider, every nurse brings different things to the table. This particular incident that I talked about where we mitigated this patient's problem because it was one of the last clinical experiences that I had. So all of that was fresh in my mind, all the evidence,
right,
stuff, information that was fresh in my mind. So I brought that strength into the clinical setting. So every provider, so the symptoms that are similar between these 2 women, their particular providers may not have a great deal of experience in those areas of symptoms. Right. So in some cases, it may be, and I hate to even bring this up because you personally know how I feel about insurances and their involvement in care. But in some cases, it's worth looking at other providers, researching which providers in that geographical area have experience in those symptoms.
Right. No, I agree. I agree with you. And that's great advice for anyone who is, entering a situation like this. Again, like the 3 in particular that I'm talking about they cross their T's and dot their I's, but not everyone would think to do that. So, how is, I know that you do have experience, with insurances. What would you recommend someone to do? Just start doing a Google search, or actually call their insurance provider and say, hey, I need a doctor that specializes in, or is there a case manager type situation with the insurance companies? Like,
So
is there something in particular they can ask for?
First of all, let me preface this next bit of conversation with, I strongly dislike Dr. Google. Okay.
Okay. I think most medical providers do.
Yes. So here's why I say that. And it's relevant to what we're talking about here. When you Dr. Google, you go in with, these are my symptoms, this is what Google says, and you instantly put that provider in defense mode instead of, okay, let's get to the root of this problem.
Right.
Okay. So I do not like Dr. Google at all. So
and
I shouldn't
also
say that
feel,
because hold on.
Let
me back that up, because I do myself use it sometimes. So I do sometimes use it myself. So, and I do have a list of things that we can go over about how to get yourself heard.
Yeah.
But
I feel with Dr. Google, some people will put in their symptoms, type it in, and Google will say, oh, it could be this, which is very, very minor. And then it goes down the list of, and then it could be this which is life threatening. And, and there are some people who automatically go to the life threatening, and then they see nothing else, because now, they've become so upset that they think it's going to be the worst case scenario, that they can't see anything else. They can't see any, oh, well, I don't actually have this symptom, or so yeah, I get it. It's not the best case scenario. I'll put in, I'll use Dr. Google myself, but it's more for, what does eczema look like? Or, what does spider bites look like? And so, I can take a look and say, oh yeah, it doesn't look like that. What does cellulitis look like? That was one, that I pulled up when I had, after I had the stitches in my leg. Because
and I'll be honest with you, I did it. So I was, I guess maybe a year and a half ago, I was diagnosed with a condition called lectin sclerosis. It happens in postmenopausal women. And it's very uncomfortable, to the point where it had gotten so bad for me. I was training actually. I was going to do a half marathon, and I was training for that. My way of training for that is I do a lot of bike riding, as you know. And I ended up not doing the half marathon because of not being able to train because of this condition. And so I had put my symptoms in, what could this be? And immediately it came back lectin sclerosis. But when I went to the GYN, I didn't even bring up that I had Googled this. I didn't even bring it up. They looked at that area, and I happened to have a physician assistant who had been around for a nurse practitioner who had actually was older. She was my age, maybe a little bit older, and and I will be 60 in September. And she's like, oh yeah, this is absolutely typical. She was actually working with a new physician assistant who was precepting as a new PA at Geisinger's GYN program. And she took one look at that area down there and was like, oh yeah, this is lectin sclerosis. You could just tell by the way it looked. And I was like, so I felt very comfortable with that. And like within a week, like the burning and all of that very uncomfortableness was resolving. And I was back to, now I was not able to get on the bike again for another month because they wanted it
Right.
completely healed with the corticosteroid. So, but it's how I approached it, right? So I go in and say, hey, these are my symptoms. What do you think? Can we look at it and see what's going on? This is what I've tried. This is what has happened. This is, and we need to figure this out because like I am miserable and I missed a few days of work because of this, because I couldn't sit, I couldn't walk, I couldn't do anything. So we have to be very careful how we use that.
Right. I agree. And I think those are great pointers for people. So if you didn't catch those, if you use Dr. Google, don't just, print out the materials and shove them in your doctor's face and say, I think this is what I have. Go with the symptoms first and, and ask the questions. What do you think it could possibly be? Because, when a doctor initially can't figure something out, they're going to ask you more questions. I feel that way. They're going to ask you more questions and then they might just figure it out through the questions. But yeah, you're right. Going in with like doing your own research and saying, I think, I pretty much think this is what it is. I think that is the wrong approach.
Very much the wrong approach. But instead, do what I did and take these questions, write all of those questions down, write them down, right? So again, I'm going to go back to each doctor has their own level of expertise. A good provider will say, hey, this is not my area of expertise, but let's get somebody whose it is, right? Now, here is where I come back to the insurance part of it, because your HMOs, these providers get, and I don't know if they still do, I've been out of insurance for about 5 or 6 years, but they used to get kickbacks for treating patients in-house and not putting referrals out there. I don't know if that's still a practice.
Yeah. When you say in-house, do you mean in like in that
family
network?
Keeping them within their family practice.
Within their family practice. Okay. So there are 5 doctors in the family practice. And I look more at orthopedics. So that for me is, easier to think about it. So, I go to an orthopedic and they have a bunch of practitioners and I'm going for my knee. But, the doctor that I went to for my shoulder is the doctor that, I went to because I knew that doctor. So when I go to see my shoulder doctor, again, this is just a scenario. When I go to see my shoulder doctor about my knee, he should say to me, hey, I'm not a knee specialist, but we have a knee specialist. His name is Dr. George.
That's an excellent example. So the whole idea,
I break things a lot, so it's very easy for me to go the orthopedic route.
I know. Yeah. So, so here's the way. The way a health maintenance organization, or HMO as they are called, is supposed to work is your primary care is supposed to be your gatekeeper. That is supposed to be your primary point of contact. So what happens, and here's an education tip for everyone, because being an emergency medicine nurse, I see this all the time where the emergency room is misused or overutilized simply because people come there because it's free, right? Especially the indigent and the Medicaid patients.
Sure.
Okay, because it's free, right? So but to appropriately utilize the healthcare system, you should be going to your primary care first and saying and advocating, hey, these are exactly what we have been talking about. And then letting him decide, you and him together, not letting them not letting them, because you should never just follow
Absolutely.
blindly. I
I
don't
agree.
believe in following blindly. However, people my generation and older tend to do that out of not knowing how to,
Sure.
and I don't want to use the word ignorance because I hate that word, is like, it's derogatory.
Right.
But
Right.
we don't know, right? We don't know. We have been conditioned as humans growing up in our generation to trust these people in power.
Right.
And power is a bad word
Absolutely.
for healthcare, but it's
No,
appropriate.
you're right.
So-
To trust their expertise. They're at a different level than we are, and to trust their expertise over our own. Yeah. I got you.
But it goes back to what you said at the beginning, where we know our bodies.
Mm-hmm.
So
Absolutely.
here is another example of that, knowing our bodies. I was 40 years old. I was bleeding and having clots the size of my fist, and it was a lot, and it was awful. My kids had just gone into the Army. Both of them were being deployed. James was home on leave when I had my hysterectomy. But I went in and I said, hey, this is what's going on. I said, I'm not using those body parts anymore. Like, I'm done having kids. I'm not starting over. We can get rid of it. Like, it's causing me a lot of pain. It's causing me a lot of problems. I already knew that I had PCOS. I already knew that there was going to be some endometriosis there. It was extremely painful.
Absolutely.
And here I'm going back to my experience with insurance. My insurance at the time said, nope, we have to do an ablation first. Okay. And I was like, I know my body. I know I'm not using those. I know I'm at a point in my life where I'm ready to move on and be the adult that I've always wanted to be. I'm done having kids. I don't need those parts anymore. Short story, I had the ablation, and not less than 6 weeks later, I'm back to clots the size of my fist, bleeding. Now, that's not supposed to happen with an ablation.
No.
No. Because you literally totally burn off the uterine, the inside of the uterus, right? So, but I'm back to that. I get a different doctor in the practice because my doctor is on vacation, and she does another DNC, and I come out of the OR, and she's like, hey, I biopsied this one spot because I didn't like how it looked. It was very minute spot, very minute. Now, and I have a strong family history of cancer. All of my mom's siblings have had cancer. My mom has had breast cancer now. I am BRCA positive. I had already had colon polyps, so there was obviously that fear, and I was young. I was 30s when I had my colon. I was in my 30s when I had my colon polyps, so I was young. So, the doctor at this practice, so I was working at the time, and I had already seen the coding on the procedure, so I already knew that it was a cancerous tissue. And I will never forget the phone call from that physician. He says, Janet, I am so sorry. I just put you through 2 surgeries. This visit that you really didn't need, when we really needed to do a complete hysterectomy. Now, this physician was recently out of his residency, recently out of his fellowship. And I was like, very pointedly said, doctor, let this be a lesson to you that we as women know our bodies, and you always need to listen to your patients.
Right. Absolutely.
Now let's get this scheduled.
Right.
And I was pretty young and dumb at that time, and pretty not really assertive, but reactive, so it just kind of, it didn't, I would hope that this physician learned from that.
Yeah. Yeah. But also I have to ask go ahead.
No, go ahead.
How much of that, like having to have the ablation first, was more of an insurance thing, because at that point they didn't biopsy, so they didn't find the cancer. How much of that, because again, I'm going to go back to the orthopedic stuff because that's my wheelhouse. Before I had my knee surgery, I already knew what was wrong with my knee. Had been what was wrong with my knee. And, I had to go through the physical therapy. I had to do the PT, I had to do the shots, I had to do, and that's like as per the insurance before they'll allow the MRI in order to then go ahead and do the surgery. So
I would say,
how much of that was insurance?
I would say probably 97% of that was insurance. Yes. And that's going to get back to the bane of my existence with the insurance companies, because I've spent years fighting them on the professional level for patients, for providers, to get what's due to them under their contracts, right?
And I know you don't have this stat, and if you do, I mean, then you're amazing. But I mean, it's just more of a rhetorical question of how many people have died because insurance says, nope, you have to jump through this hoop first, and then that hoop, and then this other hoop. And now I know, like, good doctors, they will advocate. I mean, my doctors have advocated for me, with my knee surgery. My doctor advocated for me with my back surgery. My doctor advocated for me. So a good doctor will advocate for you, but that doesn't mean they're going to win.
And that's anything in life, right? We don't know if we're going to win when we put up a fight, right? So that's anything with life. And I think that's where you need to be realistic, and you want a doctor who's going to fight those insurance companies for you.
Absolutely.
And a lot of these doctors who work for hospitals that have 503 status, where they have to provide a certain level of charity care or free reduced cost care in order to remain in a tax-free status. So
right.
Doctors who are completely advocating for this patient will also go and say, hey, this patient's insurance company denied this. What can we do? I think there's always that question. And I think that's important as patients, that we use that too. These are the symptoms. What can we do to mitigate them? And where do we go? And that's partly going into your visits, being prepared with your questions, and let's move on to the fact is, what do you do when you feel like you're being dismissed? Because a lot of us leave there, and I'm going to be right honest with you. I see it sometimes in the ER, where I feel as the nurse caring for the patient that the doctor's dismissed a patient's concerns. So, let's move into that. What do you do when you're feeling dismissed, right?
Right.
Because it does happen. And sadly, like I said, I've seen it with some of my providers. Now, that being said, I'm gonna flip that back on the patient, because there are, and this goes back, and I hate to say this, it goes back to that microaggression, where you do have patients who overutilize the ER for stuff that is inappropriate for ER, especially at 3 o'clock in the morning.
No, I agree. I've seen it.
And so, you need to just make sure that you're utilizing the appropriate level of care for the appropriate situation at the appropriate time. And that's where Dr. Google and that, in all honesty, is where Dr. Google could come into play, right? So, Emma, like, I hate to say it, but I also use ChatGPT for a lot of things.
I do too. Everybody who's anti-AI has issue with that, but yeah, I do utilize ChatGPT.
I'm going to tell you, and you work in healthcare, we use ChatGPT all the time. Our after visit summaries are all AI, right? Literally, the The doctors use their
through
voice
chat
dictation.
GPT or like you have like
AI,
a
artificial intelligence, like not so much chat GPT,
right.
but there is an
Because I
like
know,
our Epic.
well, sure, because it's already programmed. It's already programmed in, and then you just add the missing information. Is that what you're saying?
Yeah.
Because that's how
But
my
we'll put it-
discharges look when I did case management in a geriatric psychiatric unit. I mean, everybody that's on the team plugged in all of their discharge information into, the program Epic or what have you, what people were using, and then it spits it all out in that pretty
that's what
little
happens with our
form that
Epic
everybody
business
gets.
Yep.
Right.
So
No, I get it.
So getting back, you've prepared for your visit. You have your questions. That's going to give you the confidence and the knowledge to ask the appropriate questions instead of coming in there with Dr. Google and
Right.
setting, so you write down your questions.
I was gonna say, I just wanted to specify that the questions aren't up here. The questions have to come from up here.
No.
Onto the paper. Take the notebook with you. Write the questions down.
Here's where I am going to give. Here's where I am going to give our listeners some advice. Journal your symptoms. Journal what you're doing
right.
when you're having these symptoms.
Absolutely.
How you felt when you were having them. What is different about it now? Things like that. And then you can take that in. Okay, let's talk something very common. We talk about tracking. A, your blood sugars. B, hypertension and your blood pressures. Those are two things that we always tell people to track. Okay? Always. So this gives us a log when you come back to see us. So your blood sugars, you're documenting those, you're tracking those. Food logs are very important with the blood sugar.
Absolutely.
Right? Okay. Hypertension, blood pressures. What was your stress level that day? What happened in your life that day? What kind of symptoms were you having when this blood pressure was, say, 210 over 110, right? Okay. Right. Were you having chest pain? Were you having shortness of breath? Was your heart racing? Was all of this going on? Because that gives us a sense of where you're at with those things. So your 3 women who are having these symptoms, if they keep a journal with when they're having these symptoms, what's going on in their life, and because I'm going to be very honest with you. As a nurse, I can speak confident, and as someone who has anxiety, I can speak very confidently to the fact that sometimes we have anxiety without even realizing it's anxiety, and it may manifest as chest pain as opposed to actual anxiety. Right. And I'm not dismissing these 3 women's situation.
No, you're absolutely correct. You're absolutely correct.
That's why, going back to that, and I'm a big advocate of journaling. That's why I go back to the.
And I think that is wonderful advice. And I'm going to send the link, because y'all are, if you're watching right now, that this is up on our YouTube channel, and you can watch it anytime. You can click on the link and send it to your friends. Don't forget to subscribe to the PA Empowerment Network. It is free, but you can share this link, and and I think the information that you're giving is tremendous, and I will be sharing it with the women that I've been talking to, because it is important, the journaling. I just want to talk about the anxiety for just a minute. So the one person that I'm talking about, some of the symptoms could, the potentials for the symptoms that this individual was having, which wasn't from Dr. Google, was potentially MS, ALS. Like, these are some seriously heavy things, especially for a person, who's our age, and extremely active their entire life. So each time this person went for a test, and it was continued to be inconclusive. There's no answers, inconclusive. We're going to send you for this. We're going to send you for that. Of course, that's going to cause anxiety.
Of course.
Because there are no answers yet. And my role with this friend was to try to, help bring the friend down and say, well, okay, at least they didn't find this, or they found that it wasn't this, we would kind of, do that, like the checklists. But again, with this situation, the highlight for the practitioner was, you have anxiety, take this medication, versus you have anxiety. I get it that you have anxiety because we don't know what's going on. It was viewed more as, okay, the tightness in, whatever the physical symptoms that the individual is having, they had attributed to
that
anxiety.
That is the dismissive behavior by the provider that I spoke of earlier, and that is not okay. That is where we have to find a new way to approach this provider for him or her to listen. It goes back to my journal, keeping track of those symptoms. Write down what worked to help relieve them, what didn't work, what did you try to help relieve them. Organizing your thoughts before you go into the program is very effective way to get your point across and to communicate to your provider.
Right.
So
I think that
with that journal, and bringing with you organized thoughts and knowing what you've tried to help alleviate these symptoms is an effective way to mitigate that kind of dismissive thing.
Right.
Also, bring a friend with you, a trusted friend with you. Give permission to the doctor to speak freely in front of this friend.
I agree with that 100%. 100%.
So if you don't feel, some things I'm going to suggest in that situation where, in my mind, what I hear that you are relating to me is that this was a very dismissive situation by the provider.
Yeah, and it's been throughout different doctors, throughout this process, different specialists. Yeah. It's been all very dismissive. And her symptoms, again, I'm not a doctor, but they sound very similar to the friend of mine that has, and I can't think of what the condition is. I know I said I was going to send it to you, which is very rare. And, so asking questions in that scope, might make that light bulb click and say, oh, well, that's a possibility that it could be something along those lines.
Yep. So one of the suggestions for that, obviously she felt dismissed. In that moment, turn that back around on the provider. Say something like, hey, I'm concerned here. I feel dismissed by your tone and by your treatment plan with anxiety and you just throwing a medication at me. It is absolutely okay to challenge them. I feel dismissed. You're throwing this medication at me because you seem to feel, please explain to me why you feel this is just anxiety.
Right.
And why you're just throwing this medication at me.
Right.
I understand we can't figure it out right now, but I don't want to leave here feeling like I'm being dismissed.
And I think that, I just think that adds to the anxiety then, because,
100%.
The people that you're putting your trust in to come up with an answer is dismissing you. And now, you've lost, trust in them, faith that they're going to figure it out. And that can exacerbate the anxiety. So, I mean, I get it. And it's not just serious like situations like the ones that I'm talking about. It's just in general. And I know for me, and I know you have so many great things to share. But I know like for me, and I think this is kind of ingrained in us as women, and anyone that's watching, please let us know if I'm just making this up. I wait and wait and wait and wait and wait to go to the doctor because I'm like, oh, it's probably not as bad as I think it is. Or, I'm going to get there. My blood pressure one time was extremely high. I had no symptoms, nothing other than this extremely high blood pressure. And I'm like, oh, it'll come down. Oh, it's fine, and by the time I convinced myself I should probably go get it checked out, it was even higher. And then
I'm kind of chuckling at this, Hope, because we just went through this with you, right? With your injury. Sends me a text with a picture. Hey, what do you think? And then what, like 2 weeks later, you're in there with an infection.
I know, but yeah, I know, right? But listen, I advocated for myself with that. So, I mean, just, putting it out there for the people, why I took a little bit of a break is if it's not a funky injury, then it's not on my body. But I have pet pigs, two of them, miniature pigs, a whole, 160, 180 pound miniature pig. And he looks like a warthog. So I left him keep his tusks. Because he looks so darn cute. And pigs are pretty much 150, 160 pound toddlers without the tiaras who have, who are very strong. So he was throwing a temper tantrum and he swiped his head to the side, which just happened to be where my leg was. And his tusk caught my shin, right in a spot where there's not a whole heck of a lot, and gouged me pretty good, So, yeah, I mean, and what I find interesting is that some people, they were like, you're going to go to the doctor for that, right? And I'm like, first of all, I didn't share. You're one of the few people that I shared the picture with because it was kind of gross. I
agree. It was, but I'm used to seeing stuff like, look, I'm used to seeing stuff like that.
But notice I still asked you first if you,
yes, you did,
if you wanted to see it. So yeah, it was kind of gross. Obviously, I'm a rough and tumble girl. I'm going to scrape myself up, whatever. I'm not going to go, to the hospital. Throw a couple butterfly Band-Aids on it. But this obviously was, absolutely serious. And even with, having it, they gave me antibiotics in the hospital. And I could have advocated for myself better because I'm like, hey, yeah, that's infected. I know. I sent the pictures to my doctor and they said, oh, that looks normal. So I'm like, all right, well, okay. Like I just went with it. And then even though here's for me where it gets, and I still don't understand this, Jeanette. My temperature normally is in like the high 97s. And my temperature had been running 99.5, 99.8, 99.9. It never breached 100. And, what they said to me was, if your temperature, if it is 100.4 or more, then they said either come in here or go to the ER. So it's talking about the ERs being overused. They said either come into the office or go to the ER. And it never got to that point. So again, part of me was like, all right, cool. I'm just listening to the doctor instead of advocating more for myself. And had I done that, because that they put me on a stronger antibiotic, because when I went in to have the stitches taken out a few days later, my provider was like, oh, hey, yeah, that's totally infected. Yeah. So I should have advocated stronger for myself, and I didn't. And luckily it wasn't something that was as serious as some of these other conditions. And that's totally on me. And I'm like, well, they say it's not infected and, I don't have the fever. Like I wasn't checking all the boxes.
Right.
We're
Right.
checking all the boxes.
And that's very typical. So technically, healthcare providers do not consider a fever until it is 100.4. Even though your body temperature is normally sub temp,
Right.
subnormal. So in that case, what should have been asked, and I think I did ask you these, are you having chills? Are you having any of those? And I don't remember. I'd have to look back through the text messages, but that's where you kind of have to look, that is where you get grouped into that classification, right? Instead of looking at the individual body.
Right.
Now,
I gave all the symptoms that I was having.
Yeah. The follow-up question are you having any chills? Are you having body aches? Are you having things like that? That would also indicate signs of fever.
Right. And
typically,
none of those were asked of me.
Right. Yeah. So those are things that should have been asked.
Right. But again, I was also
that's
very
a good
thorough
triage. Those are good. That's a good triage lesson because, when you come to the ER or you call into your providers, they're doing a thing called triage. And the absolute people who are going to die first are the ones who get seen. And I always use, and when my filter doesn't work, I say, triage is not a game you want to win. It is not about going first. You don't want to win that game because that means you're dang near dead.
Right.
So, so if you're sitting 12 hours at the ER, it's because there's other people who are dying and you need to show them some grace.
Right. Right. Agreed. Agreed. My blood pressure was 96/54. So they kind of took me back right away.
Yeah, you were septic. Yeah. So what was your pulse rate at that point? At that point, I'm looking to see, okay, what is your pulse? Because if your blood pressure is low and your pulse is racing, you're probably septic and you probably need IV antibiotics.
Yeah, no. It was, I was having a vasovagal response.
Okay.
Yeah, I was having a vasovagal response, but I keep, you and I could talk like for hours with this information, but I think we have about 3-4 more minutes. So, and we didn't even get to menopause. So that's going to be a whole other conversation because there's so much
be a whole other conversation because there are, we talked about dismissing that as anxiety. Menopause creates anxiety all in of itself. So that is a whole other show. But what else can I share about advocating for yourself? We talked about,
let's just go over those bullet points. We talked about going in, with a list of questions, journaling your symptoms, what you're doing when you're having them, what time of the day, what have you. And you know what? And I appreciate that you bringing that up because that is something that I tell my hospice families all the time for keeping track of, when did they start feeling pain again? Was it in between, the time frame of when they're allowed to get their pain medication? Do we have to adjust that? Do we need, need it scheduled and then also a PRN, but I never thought of it about just other situations. So that is extremely helpful. And taking another person with you was a great piece of advice. And I really appreciate that. I talk very freely about losing my best friend to cancer. And I would go to some of her doctor's appointments with her. And again, like you said, have the patient, give permission for that individual to not just be there, but to be able to ask questions.
That's very important.
For me being there with her, like her son had been there with her and she, obviously had been there before. I'm a newbie, so I don't understand everything that they're talking about. So there were times that I went in with her where I had asked questions because I didn't understand the whole process to where it actually ended up being beneficial to my friend. So that's really, really important. How about, we got one more or let's wrap it all up since, Kendall's getting the big hook out.
Some of the bullet points when you're feeling dismissed or when you're not feeling like you're being heard. always ask about the possible causes of the symptoms, right? And then follow that up with, well, what makes you think this? Okay. What makes you so sure about the nature of these symptoms? And then don't be afraid to say, hey, what are you basing your decision, your treatment plan on? It may go back to evidence-based medicine, but what are you
Right.
basing that on? Right. Okay.
Right.
Don't be afraid to stop him and say, hey, wait, just a minute. I'm not finished talking. I'm not finished here. I have something else to share with you that we need to change directions about, right? And then I always be able to say, I am concerned about how you're talking to me. I feel like you're talking down to me. I feel statements go a long way, right?
Right. Agreed.
And then could you please make sure these symptoms are in my chart? I don't know about other hospitals after visit summaries, but my docs in my ER are very good about writing, hey, you were seen here for this. These are the symptoms you were having. This is what we did. It was inconclusive, or you were found to have, read those. And I tell all of my patients, you need to read this. I have highlighted some of the important things that are important for you to know, but you need to read this verbatim. If there's anything in that after visit summary that you don't feel is right, then you need to go to your patient liaison. Every hospital should have a patient liaison that deals with quality of care concerns, because ultimately, if you don't feel like you're being heard, that is a quality of care issue. And so you can take that after visit summary and say, no, this is what this was. This is what we discussed. Please research it further for me.
Right.
That is what your patient advocates are for.
So standing up for ourselves and making sure we're heard. And unfortunately, we're gonna have to call it a day for today. Thank you, Johnette. As always, we're gonna get on the menopause topic next time. Thank you, everyone. Mental Health Mondays with Hope. Good job. And we'll see you next Monday. Have a great week, everyone.
Have a good.
It's Mental Health Monday with Hope, a sanctuary where hearts can find solace. Together, we stand strong, united in our journey, discovering the strength within ourselves. Have no fear, for we're not alone.